To begin, turmoil at the nation's premier health agency, the CDC, and what it could mean for public health in America. Here's Robert Costa.
At the end of summer, Congress is often sleepy and slowly gets back to work.
Senator Cassidy, all eyes are on you. What's your next move?
But this past week was an exception.
How are you feeling about Secretary Kennedy at this point?
On Capitol Hill, the arrival of Robert F. Kennedy Jr., the controversial Health and Human Services Secretary, sparked a reckoning over public health in America.
Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true health care system that tackles the root causes of chronic disease.
And tempers ran hot at a hearing before the normally staid Senate Finance Committee.
This is not a podcast. It is the American people's health that's on the line here.
Democrats rebuked Kennedy, perhaps the most high-profile member of President Donald Trump's cabinet.
When were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
There were Republicans who offered broad support for Kennedy.
President Trump and Secretary Kennedy have made a steadfast commitment to make America healthy again.
Yet some notably did push Kennedy on how his long-standing opposition to vaccine mandates is affecting policy, and on Kennedy's doubts about the safety of various vaccines.
And there are real concerns that safe, proven vaccines like measles, like hepatitis B and others could be in jeopardy.
The committee room standoff had been brewing for days. On August 27th, the government announced new restrictions on eligibility for COVID vaccinations. That decision prompted some health organizations to warn the policy could cause confusion. That same day, the Trump White House said Susan Menares, the director of the Centers for Disease Control and Prevention, who had just been confirmed by the Senate weeks earlier, was fired. The Trump White House stood by Secretary Kennedy's sweeping changes and by the firing.
She was not aligned with the president's mission to make America healthy again.
In a statement to Sunday Morning, a White House spokesman said the administration has full confidence in Secretary Kennedy's leadership at HHS to advance President Trump's MAHA agenda. Susan Menares has written that she was pressured to compromise science itself and to sign off on people who have publicly expressed anti-vaccine rhetoric. This turbulence has put Kennedy, who was a key Trump ally during last year's campaign, in the spotlight.
Is there pressure inside the Republican Party to stand by Secretary Kennedy?
Nobody's pressured me or ever called me on it. I sort of speak my mind, and these are long-standing beliefs for me.
Kentucky Republican Senator Rand Paul, an ophthalmologist, supports Kennedy. Paul lays blame on scientists, not skeptics, for worries about vaccine safety.
All the doubt over vaccines there might be some doubt coming from those who don't want you to take a vaccine, but quite a bit of doubt is coming from the establishment that I believe is authoritarian in nature. They don't care whether they tell you what to do. You should just do what you're told. We know better than you.
But some who have worked at the highest level are fighting back against criticism and are sounding an alarm.
Do you still trust CDC information?
Doctors Jennifer Layden.
I have concerns.
Do you still trust CDC information?
I think for vaccine information, vaccine safety data, I would be very concerned.
Daniel Jernigan.
I would be concerned.
Deborah Howry.
It's why I left. I'm very concerned.
And Dimitri Daskalakis. All four former CDC officials have resigned in recent days, some citing Secretary Kennedy's vaccine policies, others citing the upheaval at the CDC, which provides crucial health guidance nationwide.
We've already crossed the line. The COVID recommendations for children and pregnant women are completely not based in any evidence that world experts agree on.
You know Secretary Kennedy would push back on that. What would you tell him?
Yeah, easy. The recommendation is that that there should be no healthy kids that get the vaccine. It should only be in kids with underlying conditions. Kids that are 6 months old, 56% of them that are admitted to the hospital have no underlying condition. So by not offering the vaccine to parents who are willing to do it, those kids that could have been protected won't be.
How would you label Secretary Kennedy and his view of vaccines? How should we understand what's happening?
I think he has a significant distrust of vaccines. I don't know that he's driving a get rid of vaccines agenda. It's more death by 1,000 cuts, death by 1,000 questions, calling into question data that has been accepted for many, many years. And simply that calling it into question brings into people's minds that maybe I shouldn't get that vaccine.
When he started, I read his books. I wanted to better understand his research and his background on it. So we were open, to having those discussions.
In an additional statement, the White House said, Americans haven't forgotten how the science was politicized and weaponized during the COVID era by unaccountable health officials to push intrusive mandates, adding the Trump administration is committed to restoring evidence-based gold standard science.
Help me understand why all this matters. If the CDC has top officials leave, some people might shrug. Doctors moving on. Is that how you see it, or is there a real significant cost to what is happening?
We're talking about the whole public health infrastructure of our nation. And I think when we start to see, and we will, outbreaks that normally don't happen, so more foodborne outbreaks, Legionella outbreaks, rising measles cases, people will start to care. That may take time for us to see some of those negative consequences, but that's what the ripple effect of all this will do across our nation.
In fact, ripple effects are already apparent. Just this past week, Florida's Republican governor announced plans to eliminate all childhood vaccine requirements. Meanwhile, West Coast Democratic governors who oppose Secretary Kennedy's policies are moving fast to protect vaccine programs in their states.
What is the consequence for the country when you have such a differentiation? It's splintered.
It's severely splintered, and I'm very worried about it because diseases don't obey borders.
For Dr. Atul Gawande, a surgeon who served in the Biden administration, Kennedy's actions could upend not only federal agencies, but U.S. standing in global health.
There isn't always consensus, for sure, among our own medical community. But we generally have been able to come together enough to be able to say, here is where we can assure getting, whether it's COVID boosters and making sure we don't leave out the people who are most in need of vaccination, to making sure we're not abandoning our childhood immunizations. Countries around the world are baffled by, are now falling into a civil war over whether the discoveries that have saved the world mattered.
Later this month, the CDC's Vaccine Advisory Board, now featuring Kennedy appointees, will meet to decide future guidelines.
Trust, at the end of the day, helps assuage doubt.
Trust helps assuage doubt.
But is trust still possible in this environment?
Trust is still possible, but it is not possible while we have leaders who actively drive chaos, who actively are trying to create uncertainty and break down trust. But ultimately, people have to choose the leaders who have the track record of demonstrating better outcomes. And those leaders are scientists, health professionals, and others who have demonstrated over years that they actually get you better results.